As the Omicron surge tapers off, the damage has been done. Tennessee reporting the highest number of deaths per capita in the country, and doctors are preparing for the worst. Welcome back to News 2 at 4. I'm Alex Dennis.
And I'm Mirka Francis. Deaths typically follow weeks after a COVID infection and initial hospitalization.
And News 2's Gerald Harris spoke with a Vanderbilt University doctor about what is happening across the volunteer state. Gerald.
Yeah, deaths are peaking in Tennessee with little action from the state, but there's hope that the surge could be over sooner rather than later.
We hope for the best, but prepare for the worst.
Tennessee is among states leading in COVID cases and deaths.
I think at the current time, we're in a critical transition period. We're seeing Omicron spreading widely, still creating many cases.
Despite the spread of the highly contagious Omicron variant, areas of the United States and parts of the volunteer state are seeing signs of good news.
But in many parts of the country, including here in our own, we seem to have a plateau in the number of hospitalizations and even in some places a downturn. Now, it's still early days. We can't celebrate yet, but if this trend continues, then perhaps sometime in February, we might finally get ahead of this virus.
And as of right now, there's a spike in hospitalizations of Tennessee kids. Dr. William Schaffner says he would like to see an increase in COVID vaccination for children.
COVID is less apt to produce serious disease in young people, in children, than adults. Less apt. If it spreads widely, that means it will reach some children and make them very sick and hospitalize them. We're still seeing that.
Tennessee's Department of Health has chosen to do away with daily COVID-19 data. 52% of Tennesseans are vaccinated, with the possibility of more COVID variants down the line.
The virus is not going away. In order to keep that level as low as possible, it's better that the proportion of the population vaccinated be very high.
And according to data by the CDC reported to them by the state, Tennessee last week ended with a 7-day average of over 16,600 cases. Reporting in downtown Nashville, Gerald Harris, News 2.